And then what is the sequence of coronal slices? As you go from here in the brain, as you go through a coronal series from here to here, what is the sequence of coronal slices? Since I pointed to my own head, it sort of answers the question, though.
A to P?
Yeah, that's right, A to P. And what is the sequence of horizontal slices? Yeah, that's right. And what is the sequence of sagittal slices?
Medial to lateral.
Yeah, medial to lateral, that's right. So that's important to understand also. Okay. All right, so what kind is this kind? See, it's coronal. And then what is the relative position of this one with respect to this?
Further back?
Say again?
Further posterior?
Yeah, that's right. How do you know that? You can see more putamen.
Okay.
You only see a little bit of putamen there. You see more putamen here.
Where's the putamen
More
on this?
posterior?
The putamen is here.
Okay.
Yeah, so this one's more posterior. What's that?
It's recording right now.
Okay.
Isn't that a bleed?
Yeah, that's right. I use a more precise term. That's yeah, it's a hematoma. I'll take hemorrhage also. There was a hemorrhage there.
Where?
Right there. There was a blood clot sitting in that cavity. The blood clot is lost, but you can still see the discoloration produced by the fact that there was blood in there.
Is that the putamen?
Yeah.
Okay.
So what kind of condition is associated with diffuse lesions, like diffuse hemorrhages or hematomas in the corpus striatum, especially in the head of the caudate and the putamen?
Like a
Stroke.
Well,
Oh, the one that you said,
yeah,
Who's he talking
the
about?
hem-
no.
that's right.
Something
Yeah,
specific?
Yeah.
yeah,
he
the
wants to
chorea
say-
is, and you can use Huntington's chorea as an example.
What?
Are you gonna ask that?
Yeah, that's legal. I mentioned
Huntington's
that in class.
disease?
I said it
No,
in class.
Korea.
Is it Korea like the
The Korea,
country
like
Korea?
the country?
No, it's C-H-O-R-E-A.
H-O-R-E-A. Huntington's Korea.
And there's a whole,
Hemorrhage by the putamen?
Yeah.
well, no, diffuse, you have to, not just one, but scattered lesions or hemorrhages
Is it hematoma?
in the head of the caudate nucleus and the nearby putamen.
Will you take hematoma for that?
Yeah.
Well, how would
But you have to say diffuse,
Okay, diffuse.
scattered.
How would you word the question?
What kind of condition is associated with this sort of thing in the multiple, and on the other side you can see more
Is
of
it
it.
diffuse?
So you would just say Huntington's Korea?
That's
I
right.
think he was-
I'll take Huntington's chorea. It's actually the choreas.
Okay.
There's more than one chorea, but in fact this pattern is more often associated with Huntington's chorea. Okay. And then, as I said, keep in mind that as I said earlier in the semester, and I repeated a number of times, you should know the functions for these different things that in that neurophysiology handout. When I mention functions that relate to these things, you should know those. So as a group, what are the basal nuclei, with the exception of the amygdala, associated with? Automatisms. I mean, it says that in the neurophysiology.
That's from last semester, right?
Yeah, so I said you had to know those functions.
That's gonna be on tomorrow.
Well, some of them. It's going to be more identified for A and identified for B than functions, but some functions will turn up.